For many top professionals, we're talking physicians, executives, founders, getting to the peak of your field brings this whole unique set of pressures. The very same traits that drive your success, they can also create some pretty intense internal challenges. So what happens when the people we all count on to hold it together are struggling themselves? Well, as we're about to see, the traditional support system really wasn't built for them. Let's get into why.
Does this story sound a little familiar? This physician, she spent 15 years building her career, but now she's having panic attacks, questioning everything. And her biggest fear? It isn't the burnout itself. It's the consequences of actually asking for help. What could it mean for her medical license, for her reputation? And look, this isn't just one person's story. It's a snapshot of a very real, very quiet crisis.
And this isn't just a feeling, right? The data backs this up in a huge way. A report from the American Medical Association makes it crystal clear. 43.2% of physicians report symptoms of burnout. That is nearly double the rate for other U.S. workers. So here's the most important takeaway from that. That feeling of being completely overwhelmed, it's not a personal failing. It is a statistically proven professional hazard.
Okay, so here's how we're going to break this down. First, we'll look at the crisis itself. Then we'll uncover the hidden barriers to getting help. We'll see why the old therapy models just don't work for professionals, explore a confidential solution that does, and finally, map out a clear path forward.
Which brings us to the big question, right? Why the silence? If this problem is so widespread, why is it so incredibly difficult for accomplished, successful people to seek support? Well, the barriers are a lot more complex than you might think.
I mean, just look at this number. A staggering 79% of physicians agree that a powerful stigma exists in their field. The culture of medicine, and frankly a lot of other high-stakes professions, it demands infallibility. There's this unspoken rule that you have to be stoic, you have to be self-reliant, and you can never, ever show vulnerability. Seeking help can feel like admitting a weakness you're just not allowed to have.
And this fear, it is not just in their heads, it's real. Over 60% of surgeons who've had suicidal thoughts avoided getting help for one very specific reason. They were afraid it would jeopardize their medical license. You see, state licensing boards have historically asked these really intrusive questions about mental health, creating a system where professionals can actually be punished for being proactive about their own well-being. And the consequences of these barriers, they're absolutely devastating. Between 300 and 400 physicians die by suicide every single year in the US. That's about a doctor a day. This isn't just about stress or burnout anymore. This is a life or death issue that demands a much, much better solution.
So if you've ever tried to find help and just felt frustrated, I want you to know you're not wrong. The problem often isn't you. It's that the traditional therapy system, the whole thing, just wasn't designed for the realities of your professional life. Let's break down exactly why it falls so short.
Okay, so on one side, you've got the old model, the insurance-based therapy. Every single session creates a permanent record with a diagnosis code. That opens the door to potential licensing board exposure. The scheduling is rigid, and let's be honest, the approach is often pretty generic. But then, on the other side, you see a totally different approach, private pay concierge therapy. Here, you get complete confidentiality, zero licensing exposure because insurance isn't even in the picture, flexible scheduling that works for your life, and truly specialized expertise. And that brings us to the solution. This isn't just some minor tweak to the old broken system. This is a completely new standard of care, one that's built from the ground up to serve driven professionals who demand absolute discretion and expertise. So what is this thing, concierge therapy? Well, to put it simply, it's a private pay model. By taking insurance companies right out of the equation, you strip away all the red tape, the diagnostic codes, the reporting requirements. It puts your needs first, which allows for a level of privacy, flexibility, and specialization that is frankly impossible in the traditional system. And this is probably the most critical part of this whole conversation. Without insurance, there are no diagnosis codes sent to third parties, no treatment plans you have to justify for payment, no permanent records that a licensing board or a credentialing committee could ever access. The therapeutic relationship is exactly that, a relationship between you and your therapist, period. This private, specialized model is exactly why practices like CEREVITY were created. They're designed exclusively for high-achieving professionals. They're built with clinicians who actually specialize in the unique challenges that executives, founders, physicians, and attorneys face. They offer a higher standard of care because they understand your world and they exist to protect your career. Okay, so what does taking that first step actually look like? It's not intimidating at all. It's a professional process. It starts with a completely confidential discussion about your challenges. Then you work together to set clear, concrete goals. You define what a win looks like for you. And finally, you establish a flexible plan that actually fits into your demanding life. It's strategic, it's results-oriented. And this is where we get to completely reframe the whole idea of therapy. This is not about fixing some kind of weakness. This is about leveraging therapy as a strategic tool for optimization and peak performance, the same way an elite athlete uses a coach. I mean, just think about the return on this kind of investment. We're talking about enhanced decision-making in your work. We're talking about increased resilience for a long, sustainable career, stronger relationships, both at work and at home, and even reducing the physical health risks that come from chronic stress. This is about sharpening your most important asset, your mind. So let's be absolutely clear about this. Seeking help is not a sign of weakness. It is one of the strongest, most strategic decisions you can possibly make. It's a proactive choice to protect your career, to protect your health, and to protect your ability to perform at the highest level for years to come.
So look, if you're done white-knuckling it, if you're ready to talk to someone who actually gets your world and the pressures you're under, the path forward is right here. You can visit Cerebri.com to book a confidential consultation and just start the conversation.